Aloha kako. Hello, everyone. My name is Catherine Jara, and I'm an undergraduate student in the social work program. Today, I'll be presenting to you my research on understanding Native Hawaiian identity and well-being to improve mental health outcomes for Native Hawaiian young adults. So starting with the literature or how the study came to be, we'll start with what is already known. First off, I found that risk factors that lead to mental health disparities disproportionately impact the Native Hawaiian and Pacific Islander community, and Indigenous individuals who are young adults are significantly impacted by these risks. This is even more concerning because they also have some of the lowest rates of mental health service use. However, research has identified cultural identity as a protective factor against mental health disparities. And as social workers, identifying protective factors is important because it allows us to draw upon resources that already exist in order to support an individual in their needs and goals. For many Native Hawaiians, they are the experts of their own culture, which make their values, practices, and support systems intrinsic to who they are and important to draw upon. Now moving on to what is missing or the gaps, ethnically disaggregated data about mental health experiences and well-being from a Native Hawaiian perspective is extremely limited. With this lack of data also comes a lack of culturally tailored mental health interventions for Native Hawaiians, which some researchers indicate as a factor of low service use. This prompts the need to use a strengths-based approach rather than a deficits-based approach that often dominates Native Hawaiian health research. In order to acknowledge Native Hawaiians as the experts to build their mental health experiences as well as culture. Doing so may inform interventions that are more effective in improving the overall well-being of the community. Now moving on to the theory and hypothesis for this study, I used Dr. Joseph Gaughan's cultural reclamation theory, who is an anthropologist and member of a First Nations tribe in Montana. He argues that Indigenous people are healthier when they pursue their cultural practices. I found this theory relevant to the study's aims by placing culture at the center of well-being and facilitating the use of using a strengths-based approach to give Native Hawaiian young adults the space to tell their own stories about culture and mental health. Based on Dr. Gaughan's theory, I hypothesized that participants with higher levels of engagement with Hawaiian culture are less likely to have high perceived stress levels. This leads into my research design, which was stemmed from my interest in looking at the relationship between cultural identity and perceived stress among Native Hawaiian young adults. In order to further explore this, I created an online survey called the Native Hawaiian Young Adult Wellbeing Survey. I was fortunate enough to get support with this study through funding from the Hui SRC, which is HPU's research center, and guidance from my mentor, Dr. Fawn, who is a political scientist professor here at HPU. This study consisted of 20 questions on well-being, cultural engagement, perceived stress levels, and demographics. Recruitment relied on convenience and snowball sampling, primarily through the use of social media, and monetary compensation was provided through e-gift cards, which came from the funding received. Now moving into the results, the data I'll present comes from a sample size of 43 responses, which was collected over a 2-week period. I will use the cultural reclamation questions to look at my independent variable cultural identity, and the perceived stress scale questions to look at my dependent variable perceived stress levels. Data was ran through a regression model by Dr. Fawn, and although there was no statistical significance that proved a relationship between cultural reclamation and the perceived stress scale questions, insight can still be found through the descriptive data. So starting with the first question, I used to look at my independent variable, again, cultural identity. Question 11 measures participants' levels of cultural engagement and community engagement based on what the literature says about the importance of cultural values and practices, as well as relationships to others to Hawaiian identity. With the following options coded 1 to 5, so almost always, often, sometimes, rarely, and never, the majority of participants answered often or 1 to 4 days a week for both. This reinforces what the literature says on the role of culture and community engagement to an individual's well-being, and more in-depth insight may come from further exploration into the specific ways these forms of engagement occurs among Native Hawaiian young adults, as well as whether or not they are satisfied at their current frequency of engagement. The second question I used to look at my independent variable was question 12, which asked participants to respond to the following statements. The variables from these statements measure participants' perceived importance of being able to engage with culture and others in the Hawaiian community, levels of enjoyment when learning about Hawaiian history, perceived health when engaging with culture, sense of pride associated with identifying as Hawaiian, sense of belonging to the Hawaiian community, and whether or not they felt affected by the stressors and or successes of others in the Hawaiian community. With the following options coded 1 to 5, the average response for each question fell in between strongly agree or agree. Responses that look specifically at individual pride associated with identifying as Hawaiian yielded strong agreement among responses, with all participants answering either strongly agree or agree. Tapping into the specific factors that lead to the strong sense of pride may be valuable in further understanding cultural reclamation as a facilitator of cultural connectedness. Now moving to my dependent variable, perceived stress levels, I use questions from the perceived stress scale, which consists of 10 questions that measure the frequency of certain thoughts and feelings in relation to stress over the last month. But the following options coded 0 to 4, adding up the score for each response will tell you if an individual has low, moderate, or high perceived stress. I added a question on coping strategies at the end to remain grounded in a strengths-based approach. Based on the responses, the majority of participants answered sometimes or fairly often for each question, with the exception of the question asking about the frequency of feeling nervous and stress, which is a little higher. Although the average of each participant total falls in the upper half of moderate stress at 24.16, there is a high standard deviation among the data showing that responses are widely spread out. This may indicate internal conflict that may require further exploration into the specific reasons leading to these levels of stress among participants. Now wrapping up with takeaways and implications, data from the study tells us that there are high levels of perceived stress as well as perceived importance of Hawaiian identity among participants. Although I failed to find support for my hypothesis and find a clear relationship between cultural identity and perceived stress levels, the data does show that cultural acclimation acts as a facilitator of connection to Hawaiian identity. Limitations of this study include the number of responses, which yielded low variability. The majority of participants identified as female and full or part-time students. Lack of variability may also stem from the limitations of social media as a primary recruitment tool and the underlying implications of the specific approach I took to implementing a monetary incentive. Based on what is now known, I plan to use content analysis to continue analyzing the open-ended questions from my survey to build the connection between culture and well-being in future research. So far, preliminary results indicate that participants define, conceptualize, and practice well-being similarly to the ways they also define and express their Hawaiian identity, which is important to consider for more effective mental health interventions for Native Hawaiian young adults. Mahalo for listening, and to these people listed for their mana'o, and now I will open the floor for discussion.